Good morning, everyone, and welcome to Healthcare Innovation's May Digital Health Virtual Program. Securing your digital future. My name is Matt Rayner. I'm the publisher here at Healthcare Innovation, and I am so excited because we have really a fantastic program for you here today. Whether you're watching this content live or consuming it on demand, thank you for being with us here today. I would like to cover a quick housekeeping note and also share a few exciting updates here at Healthcare Innovation before we begin our first session. We encourage you to ask questions of our faculty today. I have been assured that they are ready for them, so do not be shy in asking questions. To submit a question, simply utilize the chat box within the Zoom platform. We will do our very best to get through as many of these questions as possible in our allotted time today. We are excited here at Healthcare Innovation to announce that our in-person event series, the Healthcare Innovation Summits, along with our in-person cybersecurity forums, will both be resuming in person starting in July with our Rocky Mountain Summit and Cybersecurity Forum in Denver. We will be in a total of 10 cities in the second half of this year, and we sure do hope that we have the opportunity to see you all in person at one or many of these programs. To learn more about attending, speaking, or sponsoring any of our live events, please check out our website or send us a message in the chat box today. I also want to share one other exciting note. This is now our 5th Digital Health Virtual Program of the year. It was originally planned to conclude with this program. Because of the success of these programs and from your wonderful feedback, we have programmed the Digital Health Virtual Series to now extend through the end of the year. Each month, beginning in June, we will have a dedicated virtual program on a very specific topic within healthcare, and we'll be diving even deeper to explore topics, to explore trends, challenges, opportunities, and strategies around these very specific topics. So stay tuned for programs like Patient Engagement Virtual Day in June, AI Virtual Day in July, Interoperability Virtual Day in September, and so many more. Again, you can learn more right on our website. So today we have 4 sessions that, as I mentioned, we are so excited about. Our first session is investing in the right cyber tools and services for your organization. I want to thank our partners at Darktrace and LexisNexis Risk Solutions for giving us the opportunity to host this panel. This panel is being moderated by our Editor-in-Chief, Mark Haglund. I would love to, at this time, turn things over to Mark. If you are ready, Mark, to kick off our first session of the day. Mark, take it away.
Thank you so much, Matt. And it's great to be with all of you in our audience virtually. As Matt mentioned, we'll soon be actually gathering in person, which will be wonderful. I am very excited this morning to have a wonderful group of panelists who are all experts in this area, and we're going to talk about investing in tools. This is really quite a moment for cybersecurity, as we will be discussing in just a moment. I'm going to go kind of around the clock here and ask each panelist just to spend 1 minute describing him or herself, their role, and very briefly explain what their organization is, because a couple of our organizations involved merit just a brief explanation. So I'm going to start with John Donahue. John, would you like to go ahead and just introduce yourself to the audience?
Sure, thank you, Mark. My name is John Donahue. I'm the Vice President of what they call Entity Services at Penn Medicine in Philadelphia. So Penn Medicine is a large provider in the Philadelphia region, about 38,000 employees, about close to a $9 billion organization. We've got a big IT staff, we've got a big information security investment. So I'm looking forward to being part of the panel today and looking forward to hearing from others.
Wonderful. Thank you so much, John. Joey Johnson, you're up.
Hi, everyone. Thanks for having me. I'm Joey Johnson. I'm the Chief Information Security Officer with Premise Health. I've been serving in that capacity for 10 years, so that's kind of an anomaly for a CISO in this industry, but we provide on-site, near-site, and virtual health for a large self-insured organization, so we have a bit over 800 wellness centers nationwide, fitness centers, things like that. Additionally, I work pretty deeply in an advisory capacity with the Healthcare ISAC, and I work with a number of security technology investment organizations, helping to evaluate their their portfolio companies and emergent solutions.
Wonderful. Thank you so much, Joey. Courtney, please go ahead.
Sure. My name is Courtney Timmons. I'm Director of Market Strategy for our identity solutions at LexisNexis. LexisNexis is a large data company where we leverage our data to help solve the world's problems, including cybersecurity, as well as patient matching, specifically within the healthcare identity space. And I've been in the role for a little over 4 years now.
Wonderful. Thank you so much, Courtney. Justin.
Yes, my name is Justin Fear, Director for Cyber Threat Intel and Analysis at Darktrace. Darktrace is one of the first companies as of 8 years ago to kind of introduce machine learning, or what is now artificial intelligence, heavily referred to, specifically for anomaly detection across really your entire digital estate. Prior to coming to Darktrace almost 6 years ago, I worked in the US intelligence community, specifically on counterterrorism issues and cyber operations.
Wonderful. Thank you so much. As you can all see, we have a wonderful panel of experts here, and I'm going to dive right in. Let me start by just kind of doing a very brief level set here in terms of where we're at. It's a really fascinating moment in cyber evolution in healthcare, I think. As you all know, in December, there was a terrible attack that it was concluded was sponsored by the Russian government, actually. And for the first time, it took down some hospitals and health systems in a specific way. In the past, as we know, and this is still going on, of course, most attacks were ransomware attacks where the criminals were looking for money, basically. In this case, it appears that they were looking to actually disable systems, just as this gas pipeline attack happened earlier this month. So we're in a particularly challenging time right now, and all the experts in the industry agree that it's actually going to become more challenging, which is tough to think about, that the threat vectors are going to intensify. And one of the challenges, as an industry expert said to me years ago, was as soon as the good guys figure out how to become safer, the bad guys figure out new attacks, which we all know about. So we'll never be completely safe. We just have to keep doing the very best we can. And so in that regard, one of the great challenges right now is how do we think about acquiring and using tools and systems? What is it that we should be investing in, and how? What is that process supposed to be like? So in addition, we've been going through this interesting period as well with regard to the COVID-19 pandemic. As we all know, early last spring, most hospitals and health systems had to move as quickly as humanly possible to make as much care delivery remote as possible and as much operations remote as possible. And in the moment, of course, things were very quick and rushed, and they had to be, so everyone understood that. One of the lessons that people are learning now is what is it that we need to do longer term as we move more people to remote work, and as we continue to provide telehealth-based care delivery. So what I'd like to do is begin by asking, how does the landscape look like to you in terms of looking at the appropriate tools and systems that we need to implement and how we should be doing so? How do our processes look right now in late May 2021? I'm going to start with John Donahue, and we'll kind of go around the clock on this one and get a little bit interactive. But John, per the kind of the level set I just provided, what does the landscape look like to you right now?
Sure, Mark. So we have a governance mindset that's really built into our DNA at Penn. And we try to do things from a very formal perspective. Now, the cyber world and the threat landscape changing makes it dynamic sometimes, but We start with, we do a full assessment on an annual basis, and we build a strategy or a pipeline, roadmap of the investments that we're going to make. We work that through what we call our ISPEC committee. So we've got all the senior leadership folks that are buying into that process. We present it to the board of directors. We get the CFO to sign off. So on an average year, we've got sort of a plan of what we want to do from an investment perspective, and we get the full buy-in. And it's part of a strategy. It's not necessarily knee-jerk or, where we're changing games, very frequently. But as I said, sometimes it's dynamic. Sometimes a new threat comes out and we have to say, all right, what tools do we need? We pull our folks together pretty quickly. Again, we're governance driven. We look for consensus. We're competing for dollars against other, investments in the health system. But we try to get everybody aligned. We try to really make sure that our senior leadership buys into the fact that we need to make this investment. And then we work really hard to make sure that we get that investment in play as quickly as possible. Years ago, we were guilty of shelfware, right? We need this, and then you buy it, and then you're so busy that you don't get the chance to implement it. So we really hold ourselves accountable now to making sure that when we make an investment, sometimes within days, we're deploying this technology across the organization. And that requires a certain amount of change management and communication, but that's sort of the way Penn Medicine handles it.
That's great. Thank you, John. And yes, indeed, shelfware is a sin. So let's indeed talk about governance, process, and management. Joey, how does that look like? How does that look in your organization? You have a very geographically and physically diffuse organization, and I don't know whether that has a huge bearing on this or not, but what do governance, process, and management look like for you in terms of the acquisition and implementation of tools?
It's actually not very disparate from what John said, right? I think we kind of always have a rolling 3-year strategy that's really based on our analysis of business risk tolerance. Security is just one more form of business risk. There's execution risk and financial risk and other forms of risk. And so through that paradigm, the executive teams can kind of understand what that is. So, another way that I would say it, in terms of looking at an acquisition of technology is, every product is a program. John spoke a little bit about, and I agree that, you've got to implement something, you've got to deploy it. I look at things a lot with my team and say, hey, are we strategically ready? Are we tactically ready? And are we at the right maturity point to take on whatever this new technology is, right? Because otherwise you're not going to be successful in doing it. A lot of security initiatives, unfortunately, fall to other teams to implement or adopt, right? Whether that's software development security things or infrastructure things. It requires more than a security team getting the funding and saying, hey, we want to do this. The other thing is that, and again, I agree with John, the threat landscape is dynamic. And the other dynamic variable is the rate at which the organization is adopting technology in the broader context than security, right? And so security teams are typically undermanned to be the subject matter expert on every single new technology that's coming in the door. And so there's a balance there and a degree of discipline. Today's cyber tornado is not the same as tomorrow's cyber, tsunami. And if you're or the next cyber flood or drought, right? And so if you're kind of building in a reactive model, you're really never going to catch up. So there's a lot of discipline that's there. We play a lot with new technology. We look at it, we evaluate it. We try to have like a sandbox where our teams can go and learn new technology. I think on that perspective, it helps our teams to begin to understand the problem they're actually trying to solve, rather than, hey, here's a bright, shiny thing, it looks really neat. It's, hey, what's the real problem? What's the real issue you're trying to solve? I'll push back on my teams and say, show me a few ways you can solve 60%, 70% of that problem without bringing something new in-house. Now, we don't always get to that answer, but a lot of times it really forces them to look at what we have already, what's there, is it optimized, and is it really meeting a need that ties directly to our risk tolerance in the organization. So, I think almost before you get to the new technology question, is the business ready for this? Do we need it? Is it actually appropriate? And can we implement it in a timeline that's going to make any sense compared to the risk scenario we're navigating?
Right. I think that's absolutely perfect, Joey. I agree that you're describing what strategy and governance and process look like. We all know in healthcare, in U.S. healthcare, sometimes buying happens before doing, and or maybe even buying before thinking, unfortunately. We won't name names, but one of the great challenges is we all know these tools are expensive. They should be expensive. They provide great value. So, you don't just go out and say, I'm going to buy a Ferrari and then figure out what you're going to do with it, right? So Courtney and Justin, you both are working with clients on a nationwide level. Per what we just said about strategy and governance and process, and this landscape, what are you seeing? What are some of the challenges and opportunities that patient care organization leaders are coming to you with?
Sure. I would just like to chime in. So I agree with what everybody said so far. One thing I think that needs to be stressed that I've seen just in the last year or two as a trend is consolidation. A lot of organizations, some of those usually with more resources than others, collect these shiny things, that shelfware we've talked about. And we talk about alert fatigue in our industry so much. And what I've seen is just too many tools in your security stack. And I think we need to kind of take a step back, as was already pointed out, and look at the problem. Having 30, 40, 50 different tools in your security stack is just unattainable, especially when we already know that there is a shortage of skilled practitioners to even operate said tools. And so I've been seeing across all industries this major consolidation effort in the last 2 years to just kind of whittle that number down to that top 10 or that top dozen tools. And then on top of that, making sure everybody on my team is well-versed at the same level in all of those. We're really beyond the time of point solutions. We have to really get away from that.
Absolutely. I think I'll just make one inserted comment here, which is this is so much the equivalent of EHR optimization, where there's so many clinical informatics tools, and many of them aren't even being used. Courtney, your thoughts?
Yeah, no, I would agree with Justin. I think we're far past point solutions, and we need to consolidate and find. We recommend for our customers to find kind of the one-stop shop who can address both digital and physical identity to combat fraud in terms of verification and authentication. And in doing so, find an organization or a vendor to go with that addresses both, but also throughout can be dynamic, right, within that. So you're implementing one product or one strategy, but you're revisiting it at an annual basis to then see how it's performing within your system and optimize it on an annual basis to respond to the fraud threats that we're seeing throughout the industry. And so finding a vendor that's dynamic and can change, but doesn't require additional implementation on the part of your organization's staff, we recommend is key in order to optimize and address fraud nowadays.
That makes great sense. I want to plunge into one specific question also, and then I'm going to go back a little bit bigger and talk about economics and things like that.
Hey, Mark, can I interrupt for 1 second?
Yes, please, John.
If I could touch on a word that Joey used that I think is important to talk about. It's we're talking about the pandemic. We're talking about information security investments, and Joey used the word balance, and I think that's really a key issue for people like us, because there's investments that maybe 2 years ago would have made perfect sense, but now we're dealing with providers who are fatigued. They've been on the front lines for the past 18 months, and just things like, complex password phrases makes perfect sense, right? Everybody would say motherhood and apple pie. This is something we ought to do. And then you think about these providers that have been on the front line and they're fatigued, and now you're going to add to the stress that they deal with in terms of, providing world-class healthcare. So it's a factor, I think, that as professionals, we have to think about that balance and the timing.
Yeah, I think you're absolutely right, John. One of the, we hear from clinician leaders all the time that clinicians on the front lines kind of get it, right? Kind of, but they also are like, oh my gosh, why does a certain burden have to fall on me? In other words, why do I have to remember a 35 letter or digit password, right? That and then have it constantly change like every 3 days. It does. That's a huge issue. That's the human factor. So I completely agree with you. Let me detour into one very specific question. The idea that device security remains massively suboptimal. First of all, medical device security, and then we can talk a little bit about mobile device, but medical device security, who would like to address that issue? Because I think one of the things that makes this all time consuming, expensive, and challenging is the whole medical device aspect. Any thoughts from anyone on that?
Yeah, I'd love to chime in. So in the security industry, we've been talking about the threat of IoT for, I've lost count of how many years now, and it's still woefully insecure. The medical industry, I'm just in awe. I mean, you go to any hospital and there's literally IP addresses rolling down the hallway on wheels, any number of different devices from infusion pumps to massive CT scanners. I've lost count of it. Some of them have great security built in, and some of them are still living in the dark ages. And I really do think that it's still a massive challenge for a lot of folks in that industry of just gaining visibility into what devices are on the network, and then B, just establishing what is normal for those devices. We have to accept that some of them are just sadly going to be insecure, and we have to accept that risk. And so how do we build that into our workflow? I've seen everything from those major CT scanners to CCTV systems within hospitals, compromised due to just poor security or publicly available vulnerabilities. So I would love to see some changes on that front. We're starting to see a little bit of a shift, but I still think we've got a ways to go specifically for medical IoT.
Absolutely. Anyone? Yeah, John, go ahead.
I was just going to say, we've had a medical device security program in place for about 2.5 years, and we're probably 3/4 of the way done. I mean, it's a long-lived program to get this right. We've got tens of thousands of devices, and to Justin's point, we don't know where they all are. We don't know what operating systems they're running on. So we've really begun the process of, doing some inventory and putting some process in place, making sure that as we purchase new devices, we're opening up a new pavilion. Purchasing is making the right requirements on the front end of the process, doing things like network access control, segmentation. So it's a huge initiative, and it requires a lot of resources and a lot of money. So you really need to make it a commitment as an organization to turn the tide on that.
Now, John, you're one of the first I've heard that's actually doing that, and I applaud you. I mean, that's amazing. I'm curious, are you seeing others in the industry doing that? Or as you said, is it a resource problem, a financial problem? Why am I only just hearing about this now?
Yeah, Justin, your point's going. So, when I talk to the board about this, I try to stress that we're ahead of the curve because they're not happy with our progress. They'd like to see us quicker. Yeah. And I try to always say, look, when you look across the country, we are probably in the top 10% in terms of progress. And, we got a little bit of tailwinds early on in this because there were some fears about, people hacking into those devices and changing dosage and really, putting aside, taking systems with encryption. When you start impacting, somebody's life, potentially with remote, heart monitors and things like that. So we got some tailwinds and we got some funding, but I would say that we're ahead of most on that. We're very, very fortunate that we've got the support from the board.
I would echo that.
I applaud you guys for that.
Yeah, no, same here. We have a difficult time when talking, and we have customers all the time say, I mean, who's really going to do that? And what would be the purpose? So what's the point in investing in it when we have so many other priorities, right? Tugging at our budget. And so, yeah, I applaud you because you are well ahead of the game on that one.
I have to say, one of the things, I agree, you're ahead of the game, John. And we did a survey. We're now doing annual surveys of our audience. And it was really shocking, the low percentage of survey respondents who are doing anything with network segmentation. I'd have to go back and look at our numbers. I think it was 30%, 25, 30%. That's pretty low, right? I mean, especially, I think that one of the reasons I mentioned the Russian hack at the beginning of our conversation is that was really scary, right? Because we understand what ransomware is. It's horrible, 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 but we understand what it is. If some foreign government, AKA probably Russia again, decides we're going to show the Americans a lesson, right? We're going to bring them down. Imagine if they were able to bring down a significant percentage of EHR systems in hospitals across the country, even for a week. It would be chaotic and potentially endanger lives, actually. So I applaud you, John, that you and your team are ahead of this. And as I say, I'll just mention, it's amazing to me the low percentage of, well, health systems doing a couple of things. The low percentage of those who have done any network segmentation, the low percentage that have a real governance around these processes so that they're, like you guys are doing, thinking through what they're doing, literally thinking through. And also the low percentage of those that are doing advanced things like behavioral monitoring, which is going to be so incredibly important going forward, because that's how you detect weird anomalies where suddenly one person in admissions is like looking at 10,000 records a day, and you're like, wait, why would Mary be doing that? Like, there's no reason for that. So we need to think about these advanced techniques. Now that leads to my next question, which is what I call the haves and have-nots question. Panelists, do you see a gap opening even more widely in this area between the haves and have-nots in the healthcare system in this country, where well-resourced organizations are moving ahead, like yours, John, moving ahead, doing the pioneering things that are necessary, while some of these standalone independent community hospitals in mid-sized cities, on the Great Plains, whatever, they're falling further behind, relatively speaking, right? They don't have a CISO, they don't have any security plan, strategic plan. They haven't purchased some really key technology, but even more importantly, they don't have a working team in place to kind of figure out where they need to go. Panelists, what do you think? Do you see some haves, have-nots, gaps really opening up in this area?
Absolutely. And I think we gotta quantify it a little bit when we say healthcare, right? Pharma is very different from payer, from provider, right? But you hit the nail on the head, specifically when you talk about the provider sector, which historically has been less mature, has been more in the have-nots in a lot of capacities, and it is exactly those entities you talk about, right? They're struggling for resourcing, and I think working with the ISAC on the product and services committee, we evaluate what are the best service offerings, product offerings that we can offer out to our members, and we learned years ago that is not a one size fits all, right? Our larger, more mature members have large programs, and they don't need to consume some of these things, but that we would say those entities living below the cyber poverty line, right? And they need a lot of help. They need a lot of resourcing. They need a lot of support. They need a lot of channels to get things. They need a lot of channels to support those things once they have them. You got to realize that even in the capacity of smaller hospitals, I mean, a lot of hospital entities grow by acquisition. So what you end up with is a disconnected, discombobulated group of IT fiefdoms without a centralized enterprise strategy overarching it. You talked about the medical device thing. I mean, if you think about the complexity of that problem, if you step back, it's really a business problem, right? Where for years, IT was thou shalt not touch our clinical systems. Clinical engineering owned those devices. They connected them wherever they want. And remember, there's probably no NAC or anything there. And it was, hey, you can't touch these. These are life-saving devices. Don't get near it. It's ours, right? And so you end up with all these devices all over. And the other problem with medical device technology specifically, and I'll back off of it, but I did want to make this point, is that you got to realize a lot of these technologies are very, very expensive. And they're built to outlast the operating systems on which they are originally built to connect with, right? So you might have a device that's meant to last 15, 20 years from an investment perspective, and it gets outpaced and you can't touch it. It's really only when security started stepping in and saying, hey, wait, this thing is really insecure, and there could be life-altering consequences if it's compromised. So, I had a debate with a doctor one time, and he said, well, do you want to patch this or manage this thing before or after I operate on your daughter? And I said, well, do you want me to hack it before or after I operate on your daughter? Like, what do you want it to be? and like it was kind of like this weird standoff. But that, you know, that's the state of the union where it is with some of these things. And the other thing to understand with how fast healthcare technology is moving is even what is defined as a medical device right now. Is that an app on a phone that's collecting healthcare data? Is that a fitness app? Because what happens if I collect my BMI and my blood pressure and I take those data elements and I put them into an EMR? Clearly HIPAA governed data, right? What if I take those same exact data elements and use a fitness app and pump them up to the cloud somewhere where it's totally ungoverned? Same exact data asset, same exact risk of loss, but ungoverned. So it gets to be a really, really complex thing. And I think when you look at the immature organizations who just don't have the resourcing, what I have found a lot when you peel back the curtain from the security presence, whoever is there begging for dollars or support or resources, is they hit an audience that go, I understand that the cybersecurity thing is a problem now. I get it. It terrifies me, and I have no idea where to start. It's a completely foreign language. It seems like there's 800 things that can take us down completely, and I just don't know what to do. And so there's a big education process that has to happen there to really facilitate those organizations to be empowered to understand where to start.
Yeah, I agree. You just said a million things that I agree with. Also, I'd like to either borrow or steal your phrase "living below the cyber security poverty line." I think that's a great one, Joey.
Yeah, that's open source now. You can use that anytime.
Okay, great. I don't have to do the little R in the circle, right? But I wanted to touch on something that you just said, and I would love for all the other panelists to respond to it. One of the key problems here, it's a chicken or egg thing, right? Because the less resourced organizations also almost certainly are the ones that are not as developed in terms of their human resources, right? They don't have a CISO. Sometimes, since we're not naming names, I can say this, right? Sometimes the CIO isn't really up to where they should be either. They're not that well informed. And you have a C-suite that's not well informed and a board that's not well informed, right? And so everyone's like back in the old way of thinking, which is, well, we'll just kind of keep going down the road and hope nothing happens, right? like the hope principle. And those are the organizations that get taken down in a second when they do have a breach, right? I always tell the story about how, you know, as we all know on this panel, healthcare is uniquely vulnerable because you have, in any organization, you have thousands of end users who are touchable from the outside, right? I once interviewed a consultant who consulted on cybersecurity in healthcare, financial services, and the nuclear power industry. So I was kind of fascinated by nuclear power, and I asked her, well, what's it like to, you know, consult on cyber in the nuclear power industry? And she said, well, I'll tell you, nobody knows how to reach someone who's working inside a nuclear power plant, right? Like none of us could figure that out, but any of us could easily figure out how to pierce the wall around a hospital, for example. You call up purchasing and you say, oh, you know, I had a question about something that went on, and who's the main person to talk to? And they'll say, oh, it's Dottie in purchasing, right? And so you create this phishing email that, and the subject line is, we need to check in with you about your FedEx package, right? And Dottie says, oh, I didn't know I had a FedEx package. She opens the thing, clicks on it, there you go. And then 9 months later, your entire system is locked up and they want $20 million. So healthcare is uniquely vulnerable. And yet many organizations lack that broad systems thinking about cyber. Who would like to respond to that? I bet, Courtney, you deal with a lot of organizations that are just starting to think about this on a systemic level, right?
No, that's right. They're starting to, but I mean, to the point, we have customers that are starting to, they come to us and say, all we have is username and password. Where do I start? Right. And And so we have found ourselves, and we've had to coach our sales team on, instead of taking a sales method to that conversation, we take a step back and have an educational conversation, right? They're looking for us to be the subject matter experts and kind of tell them where to start. And then we have, obviously budget conversations down the road, but it's really, what do I need in the immediate? What is the absolute need? Right? Not the desire. I need to check the box to know that I'm doing and taking the steps necessary to prevent a breach from happening. So what is it my absolute need? And then we can get into all the fancy bells and whistles later down the road. But for right now, I just need to address, and a lot of the conversation that we have is really around, the new digital ecosystem when we talk about fraud, as well as the physical. A lot of the customers that we talk to, they're used to addressing just the physical, right? Your name, address, date of birth, SSN, and making sure that the person entering into the system, it is who they say they are. But what happens when that physical identity is compromised in financial services realm, and they're using it from remote care, right, or remote access through a device that has been compromised, right, with malware or ransomware. And so we're oftentimes not just educating on where to start, but we're also educating on the importance of matching that physical with the digital. And that is, it blows people's minds at how these hackers are actually entering into the system without even physical identity. And it could be me logging in, right, as myself, but because there's a piece or something that has infiltrated my computer or my mobile device that I'm logging onto, they're gaining access. And so those are the types of educational conversations that we're needing to have with customers now that we haven't had to have before.
Yeah. I'll just mention one incident. A consultant told me about this a few years ago, and he didn't even say which organization, so I can't reveal anyway, even if I wanted to. But he was consulting with an organization, and they had this crazy situation where somehow they were able to go, the hackers were able to go in, look at email addresses, and capture email addresses from C-suite members and board members. And they actually went in and they captured the CFO's identity somehow within the system and sent out an email, quote unquote, from the CFO. Of course, it was really from the hackers,
right?
Saying to several people in payroll and accounting, I need for you to send me this financial information right now. And the CFO happened to be at some kind of conference out of the office. So they were like, yes, Joe, or whatever the person's name was. Okay. And they sent this incredibly sensitive financial information with tons of identifiable stuff to, quote unquote, their CFO, and a horrible hack happened. So yeah, a lot of basic. Justin, I bet some of what you and your team do also probably involves basic education of people, right?
I've been saying for a long time, education is obviously important, and I would never advise a customer to avoid it. But I think we've all seen that it doesn't go far enough. As you alluded to earlier, the attackers are a lot of times 2-3 steps ahead of us. And they're utilizing artificial intelligence themselves to actually craft more enticing emails. Even the most well-versed security practitioners are getting duped into clicking on this. I'll give you another example, very similar to yours. We found in one of our customers an email that came from the CEO, but it was spoofed from somebody else to the finance department, right, simply stating that my bank account got hacked. I had to change all my bank accounts. Please reroute my payroll stubs to this new direct deposit. And it was simply all of the unusual pieces of that email, the metadata that nobody pays attention to, even the way the CEO was talking, the types of words they were using. We were able to determine that this is not the CEO, and we were able to flag it for that finance person. So I think education is certainly an important factor, but we need to rely on technology as well, because education is not going to go far enough. It certainly does check the regulation box by all means.
Yeah, absolutely. I will reference one funny awkward thing, funny, sad thing. HIMSS did a survey about 4 or 5 years ago now on cybersecurity, and they found that even IT people were victims of phishing, right? Like they were clicking on these emails. It's like, oh no. So yeah. So
if you look at just to try to, if you look at the, you know, the headlines of fraud over the last year throughout the pandemic, a lot of the fraud that's happened has been employee related or vendor access, right, into internal health systems, vendors that are accessing through a vendor portal. So we're so caught up in protecting patient and member data, which is great through patient and member portals, but then you kind of leave open the employee access or vendor access. And so it's really, when we go back to the strategy, it's about a full holistic strategy, security strategy, as opposed to pinpointing one access method over another.
I would also just add one trend we're seeing, you know, that was alluded to earlier. You know, I think, Joey, you mentioned data is going everywhere now. You know, we're sending it to SaaS providers. Yeah. Big tech now is kind of diving into the, you know, the health industry. Whether or not we agree with that or not is a whole other debate. But one thing we're seeing is, because of the pandemic, this wild adoption of cloud and SaaS, attackers just come right in through the front door with compromised credentials. And for a security team, it's an authentic credential being used for all intents and purposes. We need to ask ourselves, is that really that person? Because they sure are using a password that person has set in place. And we're seeing that day in and day out, coming right in through the front door. And that comes back to the original point earlier, that behavioral analysis must become a staple in the security stack when we are dealing with all these other disparate, you know, pieces to our networks.
Absolutely, absolutely, Justin. I did a webinar a couple of months ago with great people from an academic medical center, and they were talking about how incredibly complex their landscape was, with because they also work with universities. So you had students and you had clinicians and you had people going in and out all the time, clinicians working in several different venues actually, and so they would have actually different IDs, and like it was a nightmare to manage. So let me just ask a quick question here, and then we'll eventually go to final thoughts and statements. But where are the few places in the view of everyone here on the panel where patient care organization leaders are stumbling the worst, and where they're doing the best right now in terms of everything we've talked about? Let me start with you, John. Where do you think your colleagues are stumbling the worst, and where are maybe they doing the best right now?
Yeah, so I think from a stumbling perspective, I think, you know, somebody made the comment earlier, we're falling behind. You know, even the organizations with big budgets and big resources, you know, the bad guys are getting more sophisticated quicker than we can. So I think, you know, as a whole, as an organization, as a community, I think we're falling behind. And then I think the second part we're stumbling is getting experienced leadership and resources. So, you know, there are not a ton of great CISOs out there that have experience in healthcare. And there's a learning curve in healthcare. We're in the process now of doing a nationwide search. So I have a pretty good sense of what's out there and what's available, folks that are willing to look at moving. So I think leadership is a challenge, and probably like some of my peers on the panel here, you know, keeping the talent that you have is tough. You know, people are calling them in order, you know, offering them, you know, 30, 40% more than they're making. So, you know, we're struggling to retain our key talent that we built. So those strike me as areas where we're stumbling. In terms of succeeding, I think, you know, there's better communication than ever before. Better communication among our peer community, better communication with law enforcement, and things like that, and better visibility with the board. And that's really, for us, that's where the tailwind started, was once we got the board engaged, we were able to measure their risk tolerance. We were able to ask questions like, if we were breached, would we look back and say we should have made this investment? And that was a game changer for us. It was almost a paradigm change. Instead of waiting to be, you know, maybe you said it, Joey, reactive, you know, try to get proactive with some of these investments, and don't wait to make the investment if you can afford it earlier.
Yeah. Other panelists, where are we stumbling? Where are we succeeding?
I mean, I would agree with pretty much everything John said. You know, one of the areas that it's kind of similar that I think we're really struggling as an industry from a security leadership perspective, practitioner perspective, is helping those practitioners to develop better business acumen, right? One of the biggest challenges that I see is they can be very technically focused or very governance focused, but not really understand the context of the business and how the security function plays into and supports that, right? We talked a little bit earlier about, and the topic of this panel really is, how do you make the right investments, when, where, why, right? And I think that one of the things that really drives that is being able to align security initiatives with business initiatives. And I'll use a specific example to basically say, it almost falls on deaf ears at a board level or at a senior executive level to say, hey, we need to solve at-rest encryption and multi-factor authentication and vendor access and zero trust, they're like, whatever, we lost the audience, right? But if you say, hey, we're pursuing some M&A activity that looks like this, and we're pursuing, this business venture that looks like this, here's the end-to-end security plan of what it would take to do those things successfully. They don't care how the sausage is made. They go, okay, I understand that. And I see a lot of organizations struggle with that. And I think that if we could develop our leaders to be better able to articulate those messages, we'd start to see the budget strings open up a little bit to start funding them, because they would understand what it is, right? And that the security, one thing organizations push back on the spend is because they don't understand what it is. They don't understand why they're making it. And they don't understand the ROI. John was totally right on the staffing thing. I mean, I see, looking out at the market, the workforce is getting more and more expensive. And literally, when I look at it from an ROI perspective, I go, that role just is not worth $140,000 a year for the talent that is backing that role right now. I would pay that person 65, 75 grand based on their level of talent, right? But the market will pay it. And so it's driving it up. So it forces different decisions on in-source versus outsource, right? Which I always think is a pendulum based on where you are and what you can consume. But that's a real challenge. But I do agree that the communication within the sector and across the industries is really, really growing. You've heard me mention the health ISAC a couple of times. I think it's a really, really powerful utility for especially those organizations that are struggling and wondering where to make an investment. That's the kind of thing where you can go, hey, you can immediately tap into a lot of more mature organizations and say, how did you do this? How did you prioritize it? How did you get the plan together? And you have great leadership and folks that want to participate and help you. That have been in the trenches before. So that is a great place that I think we're really seeing the industry pick up.
Right. I agree with you absolutely, Joey. I think that HISAC is a great resource. We're going to need things like that, because I personally do see some of the smaller standalone patient care organizations falling hopelessly behind soon. It's chicken or egg, right? Like, they can't afford a CISO or even a CIO who's pretty up on issues. And so they don't even have the in-house, when I say intelligence, I don't mean that they're not intelligent, but they don't have that captured intelligence to be able to assess what their situation is and to spend wisely, right? Like, because they don't even know. And then they fall further behind compared to the organizations that have a great CISO, and the CISO has a team of like 10 people who are daily doing all the things that you mentioned. Some of these smaller community hospitals, 200 beds in mid-sized towns on the Great Plains, they're like, wow, just trying to, the very most basic things, like what you were referring to, Courtney. You have to go in and just kind of explain, okay, A, B, C, D, E, right? In very simple terms. And I think in many cases, I'll just add one more fill-up to that. In many cases in these smaller hospitals, you have clinician leaders who are in the C-suite, which is a great thing overall. But in some cases, there are clinician leaders who don't really have much experience with these issues that we're talking about. And so they're kind of like, oh, maybe that'll impact us someday in the next century, and who knows, kind of thing. Whereas, wow, it could be right around the corner or happening right now. So any other thoughts? And then I'm going to go to last statements, but any other thoughts about stumbles and successes from the panel? Okay, let's go to this. what I would like to do, we have just enough time. I'm going to ask each panelist to leave us with a piece of advice in terms of everything that we've been talking about on this panel for our audience, and also a prediction, meaning what will this landscape look like 2 years from now? So I'll go, who would like to raise their hand and go first? The order doesn't matter here. Justin.
Great. Prediction, I think just if you look back in the last 24 hours, news broke that there is actually a strain of ransomware or even a wiper being used in the Middle East conflict right now. And I think what's so scary about that to me is those machines aren't recoverable, they're bricked. And so I ask myself, are we going to start to see copycats? You brought up the great reference earlier that, this is an active war. You could take out a major part of the entire United States' medical infrastructure to a point where it's not even recoverable. We need to ship new devices in to actually rebuild. And at that point, the damage is already done. So my advice to folks is especially, when talking about ransomware, we saw that Colonial Pipeline allegedly paid $4 million, and then the other case of a $40 million payout in the last week. We need to stop paying the ransomware attackers. As long as it's not profitable, they're going to stop doing it. If we keep paying it, we don't have a choice. And I understand that's a really tough situation for this industry because we don't necessarily have the luxury of days of downtime. We need to be back up and running immediately. So what happened in Germany doesn't happen in the US, and we have an actual death on our hands as a result of it. So I would say definitely talk to your general counsel, make sure it's even legal for you to be making that payment, because Treasury has put out some interesting guidance that says it might not even be legal in some cases. And look at those backups. Do those backup scenarios. Make sure you can get up and running in a matter of hours, if possible.
And how do you see things 2 years from now?
Sadly, as I already stated, the attackers are going to keep moving at a pace. I hope they're not going to be outpacing us. A lot of us in our industry, even especially at Darktrace, because we're an AI-based company, really do think we're on the premises of the attackers really utilizing AI. We are going to start to see machine speed attacks, moving in terms of nanoseconds, not hours or days. And sadly, things are just going to get smarter and faster as we move forward. And so our tools and our security stack has to do the same thing.
Well, that's a bit of a Debbie Downer thought, but it was important to share, right? And I have to say, thanks for referencing Colonial Pipeline. When I heard on the news that they had paid up, I was like, oh no. Wow, that was a bad wow. And the FBI, the federal government had told them don't pay up, and there they paid up. Anyway, oil under the bridge. Who would like to go next?
I can go next. So within the next 2 years, I think we're going to start seeing more of the industry becoming more educated around the CARES Act. We're going to see more patients getting interactive with their healthcare, right? And in parallel with that, huge security impacts with the adoption of things like telehealth, privacy challenges as patients start to send their data beyond the firewall, and we'll witness an increase in device attacks, right? Because they're simply not being addressed at the rate in which they should. In terms of advice for organizations that are just struggling to figure out where to start, I would say identify the data that you need and want to protect, such as not just patient data, but internal systems as well. Identify the access points. So whether that be patient, employee, vendor portals, call centers, in person. So how are people accessing that data? And then make sure whatever strategy that you end up going with addresses both the physical and the digital. And that would be those three things to pinpoint would be a good place to start in terms of crafting a strategy.
Thank you. And where do you think we'll be in 2 years from now?
I fear to give that because I'm going to be a Debbie Downer just like Justin. I think the industry is really going to struggle with the rate. To Justin's point, we're seeing it all the time through our contributory networks across industry, right? Our cyber report that we publish every year, a lot of the other industries are seeing a decrease in actually cyber attacks, whereas healthcare has actually seen an increase. And I think that trend is going to continue.
Yeah, it's a little bit like the often said adage, you know, why do people rob banks? Because that's where the money is. In terms of healthcare, why do people attack healthcare? Not only is there valuable data, but healthcare is almost uniquely vulnerable. So you got the combination. Joey.
Yeah, sure. So, and to finish your last statement, not only are those two problems with healthcare, but the data is fairly permanent, right? You can delete a compromised credit card. You can't delete somebody's medical record, which exists in multiple places and iterations throughout an ecosystem. So when there's a healthcare breach of healthcare data, it's not even easy to pinpoint where it happened. And once you do, it's still there, right? It's a permanently usable, viable copy of data. So that's a problem. I think that what I would say, sort of parting words, is, you know, if I had to put it down to one word, it would be hygiene, and that is the hygiene of your operational program and the hygiene of the systems and the data within it. And what I mean by that is, if you're looking at where to start, a lot of times before you spend a penny on a single solution or technology, you need to look at the things that you can do very quickly within your own organization to reduce tangible risk. So if that is very simple things like systems management, you know, access controls, patching. I mean, these are basic things that, you know, I hate to say when we talk about what's coming in 2 years, you know, I'll get there in a second, but the reality of the matter is from an attacker perspective, a lot of times, you know, state sponsors aside, attackers are lazy because they can be, right? I mean, a lot of breaches that you see are you know, compromising things that nobody did the basic hygiene. Why go any further? I don't need to spend a whole bunch of effort breaking through your $10 million wall when you're just going to leave the window open. And so, you know, that is a really important thing. And for organizations that are looking at how to get quick wins and how to get support for their program, there's a lot. If I was stepping in the door as a new CISO, you know, I can almost guarantee there's a bunch of things that I would be doing off the break before bringing in a new solution. And that is also, just so you know, it's to support the solution so that when you do bring them in, you're ready to operationalize them and make them the most effective, right? And not noisy. So I would look at that. The other thing is really importantly, as you're doing that hygiene, understand what your threat model is that you're trying to protect yourself from, right? Are you an entity that's primarily concerned with protecting from state-sponsored actors who have the compute capability to do quantum computing and really go after an asset at all costs and get it after your intellectual property? That's a very specific threat paradigm that if you're trying to protect against that, that's going to look and feel a lot different than if you're trying to protect from opportunistic cyber criminals who are just trying to get in the easiest front door or move on because the low-hanging fruit doesn't bear enough fruit for them, right? So you need to really think about what it is you're trying to protect and how, and then kind of go about it from that perspective. That said, I would say, you know, 2 years out, specifically with this industry, that's come up before, but, you know, telehealth has been embraced in a way that is not going back. The pandemic was a forcing function because the technology has been there. What hasn't been there is patient adoption and provider adoption. Now that's been there. Now that's happened, and it's not going to get pulled back. So as we start to see state regulations change around interstate practice of medicine, international practice of medicine, things like this, we're really going to see that happen in conjunction with end user adoption of technology. I mentioned things like fitness apps and all these other things that are basically unregulated. And we're going to see, while there's going to be more regulation, a convergence between privacy regulations and tech regulations, but we're also going to see a broader attack surface. One of the things that I saw a lot through COVID that I think we're going to continue to see is when you took a provider workforce that was not acclimated to being in front of a screen 8 hours a day, they were acclimated to working face-to-face with each other, with other providers, with their patients. They suddenly were adopting technologies that we already had in ways that we didn't anticipate. Furthermore, this isn't 8 years ago. An end user, a person, does not have to be reliant on their organization for technology. It's ubiquitously available at their fingertips. So when providers across disparate organizations wanted to communicate, if the organization did not have that available, then they would just use whatever was out there. They would use a Slack channel, or they would use a box.com site, or they would use whatever. So information that you would rationally expect is your intellectual property or your organization's corporate information, it resides in someone's brain, and that can land on any ungoverned platform. And I think we're going to see a lot more problems with that happening with users. Really, I mean, this is not rocket science, right? This is not crazy stuff. This is just basic things that we're going to see start to happen.
I understand. Thank you for those insights. John, you have a whole minute. Sorry.
I'll make it quick. So I'll start with the advice, and I'm going to tag off of something Joey said earlier, is that as information security professionals and leaders, we need to be more business-like. And I'll tie it to this topic of this investment panel. I think the tail end of that is starting to show the return on investment and really beginning to say to people, look, you gave me this amount of money and here's what we did with it. And here's the benefits that it provided with the organization, measuring your maturity and measuring things like that. I think if you can show that business acumen, I think you can go back and ask for more money and you'll be a trusted advisor. In terms of where things are headed in the next 2 years, I mean, the trends are scary. I think for an organization like ourselves, I think the threats are going to be more nation state. They're going to be tied to some of the research and development that we're doing as an academic organization. The target's on our back now with some of the vaccine research that we've been doing. We're seeing an uptick in things from China and places like that. So I think that's going to continue as we deal with more issues like the pandemic.
Absolutely. I'm just going to make a 10-second comment because we need to wrap. But first of all, thank you all. Amazing, amazing panel. I agree with Justin about AI. I think the state-sponsored, I'll call them terrorists here, are going to become even more sophisticated. So that's very scary. And one thing that Joey said about his window comment, what we hear over and over and over again, even as you move forward and become more advanced, you still have to keep doing the basic blocking and tackling. You have to keep educating your workforce. You have to keep doing phishing training, like weekly. And some organizations are doing quizzes, and you can win prizes if you answer all the right questions the right way. We'll have to continue to do the basics as we're also becoming more sophisticated. So thank you all. This has been an absolutely fabulous panel. I want to thank every single one of you, John, Justin, Joey, and Courtney. I know our audience has learned a lot, and I have too. And Matt has suddenly reappeared to magically to close out the session. So again, thank you all. You've been fabulous.
And thank you, Mark, and thank you, panelists, for that great discussion. I also want to once again thank Darktrace and LexisNexis Risk Solutions for their support of today's panel discussion. We are now going to take a slight break in the content. We will be resuming back here for our second session, developing a robust identity access and governance program at 12 o'clock Eastern Time. We look forward to seeing you shortly, and thank you again.
Thank you.